Hi, my name is Lene Naidu. I am currently a master's student at NMU. Today we are out in Zwede and we are assisting in collecting height, weight and blood pressure for the Hypertension program. These assessments are also linked to the Childhood Hypertension Consortium of South Africa, which aims to establish normative reference values for South African children.
I'm Mr. Bani, the principal of Daniel's Public Primary School. We are working in partnership with Hypertension. They help us in a lot of programs here at school. They also help our food handlers to prepare the food for the learners. And they also take them for trainings in order for them to prepare this food for the learners. They also help us in terms of checking our health, as we believe that a healthy mind is in a healthy body. So we are benefiting a lot out of this Hypertension program.
When we arrive at the schools, many of the parents and teachers would ask us why we're measuring the learners' blood pressure. But the reality is that children can develop high blood pressure for much the same reasons that adults do. And that's because of excess weight, poor nutrition and a lack of physical activity. Hypertension is considered to be a risk factor for cardiovascular disease, and 60% of children who are at risk of high blood pressure tend to carry that risk into adulthood, where they become diagnosed with high blood pressure as adults. According to research in South Africa, about 1 in 5 children can be considered as hypertensive. Back in 2019, KaziBantu did a study with 8 low-income schools in Gqeberha, where we looked at a cohort of about 900 children between the age of 8 to 16 years old. And from that cohort, we found that 25% of children were hypertensive. So it's for this very reason that we need to assess blood pressure amongst children.
So we know that we have a problem when it comes to hypertension and obesity in South Africa, and that has become a growing concern, which increases the risk of your cardiovascular diseases into adulthood. So it is so important that we identify these risk factors now during childhood to prevent it going into the next adult generation. Ultimately, reducing the risk factor has become our #1 priority. In terms of physical activity, all of the Hypertension coaches are trained to deliver high-quality physical education lessons, ensuring that physical activity becomes part of a child's daily routine. And that is why it is important that children are encouraged to build and develop on these healthy behaviors and habits from a young age, so that we are building a healthy school for a healthy community.